Sawadee krap. I am Narawut from Cardiac Catheterization Laboratory Service of Maharaj Nakorn Chiang Mai Hospital of Chiang Mai University. I am addressing you cardiac electrophysiology stimulation testing and catheter ablation, since you may need it. So EPS, or cardiac electrophysiology stimulation testing, is a treatment for the patient with unexplained fainting or near fainting, or the patient with documented palpitation with heart rhythm disturbance, or the patient needs specialized heart conduction study. We can combine radio frequency catheter ablation, as known as RFA, or similar technology in this treatment and testing. To ensure treatment for any patient needs heart rhythm control by ablation means. Or maybe they may need ablation for specific indications. What is the EPS? Actually, it's the way to assess your heart electrical system with or without induction of heart rhythm disturbance. Pretty much an electronic study of your heart. And we need some tools. Those tools are catheterized into a specific wire that can be placed in your heart through your groins or other veins. We may pass those catheter through a specific plastic tube through the groin over your vein at the legs, groins, or underneath the collarbones, or maybe through other specific vein to get the passage into your heart chamber. And with specialized recording system, we can study your heart rhythm precisely, and we may be able to induce or bring in or simulate disturbance, heart rhythm that you may got before or are at risk of it. Like this. We are studying the heart rhythm through the specialized recording from the wire that connect your heart and our system, like this. With certain preparation, we need certain drug withdrawal at specific time interval in case that we may need an induction of disturbance heart rhythm before treating and to make a precise diagnosis. And certain blood thinner may be withheld in specific patient. Does any drug withdrawal, including the heart rhythm medication and blood thinner, shall be made or decided as individual basis. If you are a patient in referring from other facility, the team, needs a specific discussion with your doctor prior to the procedure, and specific interval may be required. For certain patients, they may require imaging study to ascertain any existing clot in the chamber, which may preclude any specific passage into that particular chamber to prevent any clot showering. Those specific clot assessment can be made commonly through the specific swallowing tube ultrasound, or sometimes we may need cardiac computerized radiography to visualize the clot that shall be made in individual basis before the procedure. So we need a reservation of operating suite and hospital bed. So rearrangement is subjected to be made with clarification contact from our personnel. Please accept our hospital number, which begins with 05393 and following 4 digits. And your hospital bed reservation as overnight stay is mandated. Before the procedure, commonly we start with informed consent, and we will try to address any concerns of yours at our best. Local skin preparation to be made, and we need to establish venous line. In certain patients, we may need additional blood sampling for lab evaluation again. And allergic history may be reassessed to ensure that we will give you the best treatment. Sedation or evenly anesthetic service may be needed. Anesthesia can be made in occasion, and if you consider that you really need those anesthesia, please don't be hesitated to give us your concerns. We will try our best to arrange it. You will be transferred into our catheterization suite, which installed with the radiography system and the movable table to get you the maximized precise and specific location. But in case of possibility of getting pregnant, any prevention of any radiation can be made, and we are very welcome for any concerns. In case of possibility, please don't be hesitated to give us that information as well. Local anesthesia is strongly needed, and we will give it to ensure your comfort. Then vascular access to be made commonly through your groin, but other vein assessment can be made as well. During the procedure, we will try our best to assess your heart rhythm with meticulous monitor, including blood pressure and any symptoms. And with specific visualized system, we shall be able to get anatomic and electronic or electrophysiology derangement in your heart. In combined with the anatomy, we will give the best and precise treatment for you, which may be made through a catheter ablation, which is a power tool to apply power or energy at specific location to control heart rhythm derangement. Any undesirable symptoms can be found and very common, including palpitations, fainting or near fainting, or chest discomfort. Please alert your operating personnel. But we strongly discourage any movement, since any movement may give serious complication. If you need it, any inform is allowed, and we will try our best to help you getting through the procedure. And after procedure, you need overnight stay for any monitor, bleeding, observation or surveillance, and heart rhythm disturbance if to be recurrent. Any implanted device may be interrogated by the next day, and additional evaluation may be required. Commonly, we will release you by the next day. You may need another dressing replacement before leaving, and it can be removed by a week, which then you may let the water get to the area. But any weight lifting over 2 pounds before 1 week is not encouraged. Anyway, you may take shower because those waterproof dressing will allow us 24 hours water prevention. And after 24 hours, you may let the incision wet. Or if the plaster shall be gone before that, you can remove it by 1 week, I mean. For resumption of your daily activity, you can do it, but the symptoms which you get before the procedure always resolve right after procedure, but can be progressively resolved by 1 to 3 months after procedure. All meds is encouraged to be resumed, only except your doctor need revision of those, which to be discussed in individual basis. And follow-up appointment is in necessity if made, and all question or concern is encouraged to help you ensure the best post-operative care. Any symptoms that you may need an urgent visit include new episodes of fainting, near fainting, or even relapse of those fainting episodes, or any twitching of the chest wall, any skin break or discharge from incision, or excruciating pain in progress or relapse, please give us an urgent visit or contact, because any foreseeable serious complication can happen, but at a rate as low as 1%, including perforation of heart chamber, any damage to the nerve, adjacent vascular damage that may give you any trouble breathing from heart failure, or any serious bleeding or vascular complication can happen, but at very minimum, very low rate, and injury to the lungs or its lining can happen as well. Those warrant an overnight stay. Again, all questions are welcome, and appreciate your attention and wishing you the best treatment